Hello doctors, this is Dr. Hira Salman. Welcome to the case of the day. So here we are going to discuss a recall. It's a quite broken one, but we'll try to understand the mood of the question and we'll try to solve the answer. So the recall says a child with a running nose and fever which subsides and then rash appear all over his body starting from the face. So as for this recall, we can see the child, but we don't know the age of the child. And diagnosis and differential diagnosis is quite depend on the age of the patient. So we are considering this as a child, old child or a young child, but it's okay, child is there with a running nose. So the word running nose is a very layman term here, right? It could be rhinitis. We can say it's a coryza, because when we are thinking of this running nose, the 3 C's comes in our mind, right? The 3 C's like coryza, cough, conjunctivitis. So what comes in your mind with 3 C's? Definitely measles will come to your mind, right? So the word running nose, will keep this in our mind, and then fever. Now again, fever is again, by just seeing this word fever, we didn't get a clue that this fever is mild fever or this fever is high grade fever, because our diagnosis will be changed on the basis of this fever. Say for example, if it's a mild fever with these respiratory symptoms, your clue will be rubella, right? But if it's a high grade fever with running nose and then rash, definitely measles will come to your mind. So it's very important whenever you are having any recall or you're having case in front of you, just try to pick these important points. Fever, what type of fever is this? Running nose, exactly running nose is mentioned, or what is the context behind this running nose? Say for example, behind this running nose, I will always consider this as a coryza. Now, which subsides and then rash appear. It's clearly mentioned, although it's a recall, but it's clearly mentioned that the child was having running nose and fever, but now it subsides. And once the fever is finished, then rash appears, right? This is what recall is saying, but this is recall. We cannot 100% rely on this recall, right? So we can think like that. First of all, these respiratory symptoms appear in a child, and then those symptoms will subside and then rash appears. So I have some important information in front of you. I just want to share with you. First of all, we are just going to solve this thing. This is measles, and this is from Harrison, right? Okay, now here Harrison says that in most persons the signs and symptoms of measles are highly characteristic. Fever and malaise beginning 10 days after exposure are followed by cough, coryza and conjunctivitis. See, 3 C's. Cough, coryza. Here coryza, I can just imagine that running nose in that child is pertaining to coryza here, right? These signs and symptoms increase in severity over 4 days. Complex spots. See, in that recall, this important point, a very important aspect, complex spots, that was not mentioned there. Maybe it was there in the real question, but in recall it was missed. Develop on the buccal mucosa 2 days before the rash appears. The characteristic rash of measles begins 2 weeks after infection, when the clinical manifestations are most severe and signal the host immune response to the replicating virus. Headache, abdominal pain, vomiting, diarrhea, amalgam may be present. These all things were not there in your recall, right? But the thing which we absorb from here is that the fever and malaise will start first, right? As per this line, fever and malaise beginning 10 days after exposure. So started with the fever, then followed by 3 C's, cough, coryza and conjunctivitis, and then the characteristic rash of measles. So 3 things very important in terms of measles. First of all, started with the fever, then 3 C's, and then rash. This is all about. Now, if copper-like spot is mentioned, then it's very easy to diagnose. Yeah, this is a case of measles, but that was not the case in the recall. Okay, now if you can see rubella, here again I'm accessing this Harrison. So for rubella, it says acquired rubella commonly present with generalized maculopapular rash that is usually lasts for up to 3 days, although as many as 50% of cases may be subclinical or without rash. See, it's clearly mentioned maybe without rash, and here in rubella it's a low grade fever. So there are very important clues to absorb here. When it occurs, the rash is usually mild and may be difficult to detect in person with darker skin. Now they are telling about the person. They're not telling about the child. Now in children, now specifically children is mentioned, rash is usually the first sign of illness. See, it's clearly mentioned in Harrison that rash is the first sign of illness. Sign of illness. Symptoms are fever, cries, and running nose. All that can be there, but first sign is rash. However, in older children and adults, a 1 to 5 day prodrome often precedes the rash and may include low-grade fever, malaise, and upper respiratory symptoms. Now, in older children, we don't know in our recall what is the age of the child, but child is there, and here it's also mentioned older children, so it's quite okay that here they are also saying that the child can present with fever, and then later on he has developed this rash. Upper respiratory symptoms, again upper respiratory symptoms include running nose, that's a coryza, there may be cough, and low grade fever. Very important point here to be noticed is fever. In rubella there is low grade fever, in measles there is high grade fever. Very important point to be noted. Okay, now lymphadenopathy, particularly occipital and postauricular, may be noted during the second week after exposure. Here, the very important point is lymphadenopathy. If in your recall, if in your question you see anything related to lymphadenopathy, anything particularly occipital or postauricular lymphadenopathy, always think of rubella. But if there is cough-like spots, 3Cs, then definitely it's measles. And rash appearance is same in both the cases, measles and rubella. The rash started from the face and spread downward. That is same. So most of the time clinically we have to diagnose this. Now I want to show you something else. Here you can see this is measles, and this I have taken from CDC, right? The Centers for Disease Control and Prevention. So here you can see measles is just a little rash. Measles can be dangerous, especially for babies. So measles typically begin with high fever. We already discussed this, right? Measles high grade and rubella low grade. Cough, running nose. Running nose, another word for running nose is coryza. So you remember in your recall, if I show you, there's a word running nose. So this running nose is coryza. If it's coryza, the 3Cs, fever with the rash, measles will be your answer. Now, I wanted to show you this rubella thing here. See, it's mentioned here, CDC again. This is Centers for Disease Control Prevention. Here it's mentioned a low-grade fever. So, other symptoms may occur 1 to 5 days before the rash appears. So, before the rash, the baby must be having a low-grade fever or may not be. Headache, mild pinky eyes, swollen cough, running nose. So all the features of rubella are here also. And see, now you can think of this that in our recall, the answer must be rubella, because the same thing is there. A low grade fever, headache, the running nose is also there. But the very important point is the fever. What's the type of the fever? Either it's a high grade fever or it's a low grade fever. Similarly, running nose is there in coryza, in measles also, and in rubella also. But the important thing is, usually in children, rubella is usually mild with few noticeable symptoms. Then I wanted to show you this thing. This American Osteopathic College of Dermatology. Here it's mentioned measles are spread by respiratory droplet in which the virus can survive. Sorry for that. In which the virus can survive for at least 2 hours. Incubation period, there are 3 distinct phases. First is incubation period. Second is followed by fever, malaise, conjunctivitis. Upper respiratory symptoms, cough will be there, nasal discharge will be there, sneeze which persists for 3 to 4 days. Then exanthum, then rash, which begin as a rash on the scalp and behind the ears. And by the second day of rash, there is no distinction of the virus. So it's very important to understand the question, the mood of the question. If you're see, on the basis of this recall, you will never get your answer. But if you ask me, then I can say, yeah, child is there having running nose, fever. What type of fever? If it really doesn't mention there, it's okay. And then it subsides, and then rash appear all over his body, starting from the face. Very important point again is that in measles and in rubella, in both of these conditions, fever will persist, especially in measles. Measles fever will persist with infection, with rash also. But most of the time in rubella cases, fever will subside, then rash appears. So most likely this answer is getting us towards rubella, not measles. But again, I'm asking you, if if you can see complex spots here, if you see high grade fever, if you see the age of the child here, which is like in between 2 to 5 years, we can always choose measles here. So on the basis of this recall, you will never get your answer. You have to see in the case very properly, the type of the fever, especially complex spots or in lymphadenopathies. If complex spots is mentioned, buccal mucosa, geraceous spot inside the buccal mucosa, second molar tooth is mentioned, that's a measles, right? But for rubella, it should be lymphadenopathy mentioned, low grade fever, rash is the same, starting from the face and then spread downward. Okay, so here apparently based on this recall, the answer is rubella. Why I'm saying? Because it's clearly mentioned that the running nose and fever was there, which was subside. So mild fever in rubella, that can be subside, right? But in measles, high grade fever usually persists along with the rash as well. So on the basis of this recall, my answer will be rubella. Okay.